Hi, I'm Dr. Jennifer Walsh. I'm a general pathologist and medical director of the laboratories here at HHS. Pathology reports have a minimum turnaround time of 2 business days, but there can be quite a range of turnaround times up to 10 business days, although less than 5% of cases are reported in greater than 10 business days. The Fast Track Breast Biopsy Program was developed by the Departments of Surgery, Lab, and Diagnostic Imaging in order to reduce the turnaround time of breast biopsies. The goal of the program is to ensure that you have a surgical referral within 3 weeks. To do this, we aim to have a surgical pathology report within 7 days. Breast tissue coming either as a small core biopsy or in the form of a lumpectomy or a mastectomy goes through multiple steps of processing. The processing steps take approximately 48 hours and result in the production of slides that can be read under the microscope by a pathologist. The Department of Laboratory Medicine, and specifically the Pathology Department, has very strict quality assurance protocols. For example, all cancer diagnoses are reviewed by a second pathologist in order to ensure that the original diagnosis is correct. Straightforward cases can be reviewed by 2 pathologists in 1 day, resulting in an overall turnaround time of 3 days. However, in some cases, review leads to additional sampling and/or special testing such as immunohistochemistry in order to achieve an accurate diagnosis. These 2 processes can sometimes add 2 or 3 days to the overall turnaround time. The additional tests help us to come up with an accurate diagnosis with information such as tumor type, tumor grade or aggressiveness, and other information such as whether or not the tumor has been completely removed. The information on a pathology report depends on the type of specimen. For small specimens like breast biopsies, usually the only information is the type of tumor, if there is a tumor present, or the type of benign lesion. This information will guide your family doctor or your surgeon for additional management. For bigger specimens such as a lumpectomy or mastectomy, there is a lot more information. The information includes the type of breast cancer. It also includes the size of the tumor, the grade or aggressiveness of the tumor, as well as whether or not the tumor has been completely removed. In addition, we send out tissue for ER, which is estrogen receptor, progesterone receptor, or PR, and HER2 testing. This information also appears on the report. The report is written in a standardized synoptic or point form format, which helps your surgeon and/or your oncologist interpret it accurately and decide on your management. As pathologists, we are aware that when we are looking at slides, we are making a diagnosis for you, the patient. This diagnosis will ultimately affect your treatment, including surgery and medication. For this reason, we are committed to our Pathologist Quality Assurance Program, in which we review cases with other pathologists when necessary, as well as hold educational programs. Ultimately, we want you to have a timely and accurate pathology report.